moving on too
No, you
fast.
good.
Go ahead.
You good. All right. So if your restock is over 5 minutes, what do you do?
I guess you go on your little runs, whatever runs you have to do outside of the HP.
Yeah. You got it
Right.
right on the nail. Bang on. Yeah, I love that.
CPR
And if it's
runs.
below 5 minutes, what do you do?
If it's below 5 minutes, you don't stand in the medicine room. Is it that's what it's called, the medicine room, or is
Right.
it?
Yeah, supply
Yeah,
closet.
you
Yeah,
don't
you
stand
got
in
it.
there, and you do not stand in the waiting area where the other patients be standing by the door and stuff. I think you go what to the. If I heard correctly, I think it's the cafeteria.
You got it.
Yes.
Perfect
Yes,
answer.
Philly. Mm-hmm. So yes, you're gonna go on your CPRs or you're gonna go on your med deliveries if it's over 15. If it's under 5, you yep, right in that cafeteria. Perfect. All right. We're gonna move on to Dr. Cello. Let me hear your 2 questions, please.
Yeah, good day. My name is Dr. Chalo Jacobs. My question I got for you is what separates you from the other workers being a better worker?
I know how to follow directions. I'm very respectful when it comes down to giving, the patients their things that they need, unless I'm being disrespected. That's, that's something I barely respond to. But I'm a leader. I see some of the workers that are wearing the same thing as me. They're doing things that they're not supposed to be doing, like AFK, standing next to me being AFK, ignoring the patients, the civilians, not giving them the pills, you know, um, just speaking out of turn and stuff like that.
Right, right.
And I see a lot of other stuff too, but I let other people catch them doing what they're not supposed to be doing. Me, I just do the job that I'm hired to do, and I get it done. I get paid, and
Mm-hmm.
I do what I need to do.
Okay, love. Like that
Beautiful
answer.
answer. Beautiful answer. I like that. So, my second and final question to you is how do you handle situations under pressure?
Situations under pressure, depending on the situation. Majority of the time, I don't lash out. I just laugh, or I don't say anything. But depending on the situation, like if it's something dealing with a coworker or something, I just wait till they cool off and then try to talk to them about the situation.
Beautiful answer. Beautiful answer. That's all.
Okay. Uh, let's think what I got. Hold up. Just give me a minute, Dr. Chair.
Yes, you fine. KP.
Okay. My question is for you.
Hold on one
Is
second, KB. Mad Pro, can you please go back downstairs? Not in another room. I'm doing an interview. Hello, Mad Pro, can you please go downstairs?
Make sure you throw up that floor too close, macro.
You know I never even
Spam
made
that
that
shit.
macro. I need to make that macro.
Okay, we will
Anyway,
disregard.
we're just gonna keep going. KB, ask your question.
okay. My question is, what would you do if somebody walked up and you was in HP and you was behind the counter, and they get behind the counter, start trolling you, and start putting the gun in your face and telling you to give them a med kit?
Okay, number one, if I'm standing at the desk, my camera's already going to be on, so it's going to be rolling. My first thing is I will basically put like, inside the chat so they can see that they're not supposed to be behind the desk, or I'll say it in the mic, like, you cannot be behind the desk. This is restricted area, you cannot be behind there. Put your gun away, no weapons allowed. And if they're not complying, I'll call somebody higher than me. And then if they don't listen to them, and then that's when I guess you call admin. If it gets to that.
That's a great answer. I'm glad.
And remember,
Okay.
record a report.
And yes, thank you.
Yeah, that's what I said. I was gonna have my camera already on.
Right. Okay, and KB, your final question for her?
Okay.
KB?
Let me think. I'm trying to see what happened. We went over it. Can you explain to me what RP15 is?
RP15.
That's a tough one, but go ahead. It's okay, you could guess.
Shit.
You said being disruptive?
No. I said give me a second.
I don't think I ever heard nobody ask that.
I don't think I was told that.
It's okay. You was told the rules, but it's okay. We don't really ask that in the interview. KB, I'm gonna make sure somebody sends you the interview questions so that when you do your next shadow, but it's okay. You can ask her something about what her requirements are, like something along the requirements of what she does as a green scrub. You get what I'm saying?
Or you can ask her how she keeps her colleagues motivated.
Yeah, that's a good one. I'll edit it out so you could just use that question. Go ahead.
Can you say that again?
His question he told you to ask was, what would you do to keep your colleagues motivated if they would want to quit? So just ask that, just like that.
Okay, what would you want to do to keep your colleagues from quitting?
I mean, persuade them that, you could be better, higher ranked whenever the time is right. I mean, look, being a doctor and a nurse, it's a lot of responsibility, but I'll persuade them to stay. Because you never know, if you leave, you might not be able to come back for some other reasons. You never know. You can't just leave and expect to come back all the time.
That's a good response.
I get what you're saying. Well, here at HP, we after our cool down, we actually can reapply, and as long as you are doing what you have to do the next time around, you usually should be okay, But other than that, definitely try to motivate them to want to stay here, especially if they worked hard. But yes, James, please go downstairs. I'm in the middle of an interview, please. Thank you. Well, that will be all. This is databi's Wallace interview. Congratulations.
Congratulations.
This conclude the video, y'all. All right.